Okay, folks, we've come to the end of the presentation. I hope what you've heard so far has been helpful to you. I'm, of course, going to do another screen share here. Before I start talking about Advantage, let's go back up to the chart here. So we've covered a lot. We've covered, oops, that's my wife, by the way. We've covered a lot. We've covered Part A, we've covered Part B, what that's going to cost you for Part B, the deductible associated with it, everything that Part A, wouldn't cover if you didn't get some type of supplemental plan. We went through the drug coverage and, how that basically is going to be dependent upon what drugs you're taking, essentially. And we went through Medicare supplement, AKA Medigap policies. Lastly, we're going to talk about the Medicare Advantage program. What they do there is they take your $134 premium you pay, they shoot it over here to a private insurance company, and they're going to go ahead and administer your health care. Let me go down and back to my original slide here. You noticed, I don't know if you noticed, but on top of this slide, instead of all apples, I have a bunch of different fruit there, don't I? So what I meant by that is now, we're not comparing apples to apples. These plans all are going to be different. The doctor may or may not take it. These plans are also one-year contracts between yourself, the doctor, and Medicare, which means theoretically, year by year, you're either going to be shopping for another insurance policy or another doctor. If you're healthy enough to shop for another insurance policy. Most people are stuck on their doctor more than they are their insurance, right? So that's one thing to note. Next thing to note about these is that you are back in the HMO and PPO system. So my example earlier of being able to go anywhere in the country with it is not going to be the case with these. Also, the one good thing, or the good thing about them is there's no monthly premium usually. Okay, there might be a slight one, or maybe upwards of $84 or something. But there's going to be some out-of-pocket costs. There's going to be co-pays. There's going to be some deductibles. There's going to be some costs per day when you go into the hospital generally. There's going to be some costs for outpatient surgeries. There's going to be a percentage that you're going to have to pay when you do your MRIs or your CAT scans, all that stuff. So you can see here the stark difference between original Medicare and Medicare Advantage plans, also known as Part C. So just a couple things. Again, original Medicare, you're out of networks. It works all over the country. As long as they're taking Medicare, they'll take you as a patient because the plans are standardized. By paying the premium per month for that plan, you're going to have no out-of-pocket costs. That's that side. This side is a little bit different. You might not have a premium up front, but you're back in the HMO, you're back in the PPO. You're going to have some out-of-pocket costs when you go to use it. So that's the big difference. Also, again, these are one-year contracts. So theoretically, you could be switching in and out of insurance or shopping for another doctor. So that is the presentation, ladies and gentlemen. I would very much appreciate it if you would go ahead and click on the very last video for me. I wanted to just share with you, my service that I provide, and it does not cost you anything, but I would like to at least just have you understand where I'm coming from with all this. So if you wouldn't mind, please click below and we'll be done. Thanks a lot.